The content provided in this video is for information and demonstration purposes only and may not be appropriate for all clients. This information is not intended to replace discussions with your doctor or other care providers. Please consult your doctor or care provider about activities that are appropriate for your medical condition. Your in-hospital therapist will be going over these exercises with you. If you have any questions or concerns with the exercises, please talk to your doctor or healthcare provider. Start with 3 repetitions of each exercise with each leg. Gradually do more until you can complete 10 repetitions of each. Hold each position for 5 seconds. Repeat exercises 3 times daily. The first step for all exercises should be to stabilize your body by pulling your stomach muscles back towards your spine. Knee squeezes, stretching. Lie on your back with your operated leg straight. Press the back of your operative knee downward towards the bed. Hold 5 seconds to tighten the muscle on the front of the thigh. Do 1 set of 10 repetitions with each leg 3 times a day. Knee bending. Lie on your back or supported sitting in bed. Tighten your lower abdominals, pulling your belly button towards your spine. Slide the heel of your operative side toward your buttock. Keep your kneecap pointing towards the ceiling. Hold for 5 seconds, then slowly relax, straightening your leg. You may use a strap around your foot to help bend your knee further. Knee straightening. Lie on your back with a roll under your operative knee. The roll can be made of a coffee can or a rolled up bath towel. Tighten your lower abdominals, pulling your belly button towards your spine. Raise the heel off of the bed, keeping the back of your knee on the roll. Lift until your knee is straight and then hold for 5 seconds. Slowly lower back to the start position and then repeat 10 times. Straight leg raises. Lie on your back with your operative leg straight and your other leg bent. Tighten your lower abdominals, pulling your belly button towards your spine. Tighten the thigh muscle, keeping the knee straight. Slowly lift the leg off of the bed and then slowly lower back to start position. Repeat 10 times. Chair slides. Sit in a chair or on the edge of your bed. Tighten your lower abdominals, pulling your belly button towards your spine. Slide your operative foot close to the chair, bending your operative knee as much as you can so you can feel a stretch. To increase the stretch, plant your foot and lean forward, bringing your knee over your toes. Hold for 5 seconds and then relax. Tilted knee stretch. Place a small roll under your ankle on the operative side. Lie on your back with your operative leg straight. Keep your knee and foot pointed towards the ceiling. Let your knee relax and straighten. Hold the position for as long as you can. Work up to holding for 5 minutes. Knee straightening while sitting. Sit on a chair or bed with your thighs supported. Tighten your lower abdominals, pulling your belly button towards your spine. Straighten your operative leg, pulling your toes up. Hold for 5 seconds, then slowly lower and bend back as far as you can. Alternate with your other leg. Repeat 10 times. Sideways leg slide. This exercise may or may not be taught to you after surgery. You may have to wait until 6 weeks post-op to begin. Your therapist will inform you when to start this exercise. To begin this exercise, lie on your back. Tighten your lower abdominals, pulling your belly button towards your spine. Keep your kneecap and toes pointing up towards the ceiling and slide your legs apart as far as you are able. Hold for 5 seconds and then return to the start position. Repeat 10 times. Your in-hospital therapist will be going over these exercises with you. If you have any questions or concerns with the exercises, please talk to your doctor or healthcare provider.